and you are welcome here.
Are you sure? I'm a foreigner, outsider.
Salam, Annie.
Alaikum salam. I'm going to stay off mute and everything off. I'm just going to listen. Hello, Warsan. Good to see you.
Hi guys. I just
Hi.
found out my volume was down. So,
That's good, alhamdulillah.
sorry. Uh, so are you all there? خلاص يعني كلكم موجودين؟
هو يعني كالعادة راح يبدون شوي شوي، فإذا ننتظر 3 دقائق شنو رايك؟
إن شاء الله.
To warm up.
Oh my God, Zainab's here. Zainab
We will
Al-Hassan is here.
Zainab's here, yeah. If it's an Iraqi audience, they'll be late.
Exactly.
This is Iraqi time.
Is that Zainab John?
Annie John, how are you?
Just checking, it's Zainab John, my old friend. It's so
Zainab
good
John.
to see you.
Thank you. How are you? You okay?
I'm good. You're doing wonders in all of the Telegram group. You know,
Really?
all
I
your
don't know.
supervision and your
Oh.
amazing, your amazing supervision.
Oh, I'm not sure. I've had patience all day, so I'm going to check it tonight for the new case.
I think Zainab Al-Attan not in our Al-Abbasiyya group, yes?
No, well, I know.
Zainab is too busy. She's
Ah.
leading. She's too busy leading criminal gangs in this country. This is her main.
Well, yes.
It's her main job.
Sort of, yeah.
Yeah,
Which Abbasiyya group? Which group is that?
Maybe Anu will talk as we have a few minutes.
Zainab, this is the Al-Ataba Abbasiyya group, which in fact, I don't think I've even spoken to you about it. This is the one. Dr. Falah Saleh is here, so he's also part of that group. It's an electronic doctor scheme whereby patients self-refer for like physical health and mental health, like free consultations, and like it's a group of volunteers. So we have a group of volunteer counselors, and Warsan is in that group. Ghufran, who is here, is in that group. Isra is in the group, and Dr. Falah is the psychiatrist with us. Isra Abdul Shahid is in the group. So many of us, alhamdulillah, have joined from that group. So they're working extremely hard. I don't think I haven't caught up with you, Zainab, in a long time. I haven't spoken with you. We've been running for about 10 weeks, 11 weeks nearly. And like we get self-referrals that come via Al-Ataba, and they're like the counselors, they're all like Arabic speaking, and they see them from here, like from the UK, and one of Isra's from the US.
Sure. Wow, excellent. MashaAllah, that sounds very good.
ما أعرف ممكن هو ناس
حياكم الله ست دانيا.
تقرأ كلها تقرأ علاجه ونقرأ عليها علاجه لا تكتبين عادي تكتبين strengthening exercise لا هاي ما أريدها باش عندهم هذا اللي
هو أنا والدكتور عبد الله الوحيدين اللي بنشاف يعني. إيه اللي حصل؟
ما فاتحين كاميراتهم.
عاوزين ننشاف ولا لا? Up to you. We don't want to disturb you.
خذ تفاعل أفضل.
I'm gonna explain this. I just question, is it me and Dr. Abdullah only on camera?
It's up to you really, because if you're a speaker, it's up to you if you prefer to see people or not. Your choice.
Yeah,
when we start with the presentation, so just Warsan camera and the paper will be shown, but later in the discussion part, it will be nice if everyone open the camera. It will be because it will be discussion.
Okay.
So if I explain the structure, the first half an hour will be presented by Warsan for the paper. Then 15 minutes will be discussion about the paper, so interactive part. Then 15-minute discussion about the topic in general. So this is the general structure for the session.
Okay.
I'm not sure I have something to say in half an hour, but I will try.
Yeah.
Yeah. بس نستنى شوي كمان دكتور عبد الله ولا؟
اعتقد راح تقدرين هسه تسوي له يعني شيرنج حتى تطلعين السكرين تقدرين تباشرين. بسم الله.
Okay, you don't have the study. Shall I send it to you?
أنا عندي موجودة، بس أنت يعني إذا من يمك حتى تتفاعلين وياها يعني تحركيها.
اوكي. لا معايا هون، بس مش عارفة احطها على السكرين ازاي.
اكو جوا هنا مكتوب شير او بيلد سكرين شير، دوسين عليها وتختارين البيبر.
شايفينها دلوقتي؟
اي.
زين. طيب، السلام عليكم يا جماعة. shall we start or we still waiting؟
بسم الله، توكل على الله.
بسم الله الرحمن الرحيم. طيب، أنا اسمي دكتورة ورسن صالح. أنا أخصائية في علم النفس و I'm not sure do you speak Arabic or English؟
أفضل عربي، لأنه بعض الزملاء هم طلبة طب يعني ما عندهم يعني مو لغتهم الأكتف الإنجليزية. قد هم يفهمون، بس السيشن من يسطوي عليهم قد يكون ثقيل، فالعربية تكون أفضل لهم. تقدرين تخليه ميكس يعني حتى نسهل لهم شوية.
اوكي. زين. أنا أخصائية في علم النفس، واليوم حنتكلم عن this research paper، مقال بحث عن
speak mix because most of them like medical students physicians. So هذه ورقة بحثية يعني عادي، أو paper يعني paper منشورة. mix.
اوكي. البحث ده عن التوتر، علاقة التوتر بالحالات المعدية الخطرة. وعملوا they researched two groups. سكان يعني تعداد سكان.
دكتور ورسن، لا تقيدين نفسك، كلمة إنجليزية يعني كلمات إنجليزية قوليها، اللي تيجي عربي قوليها عربي، تيجي إنجليزي قوليها إنجليزي. ما أريد أصعب عليك.
عملوا تطابق بين السكان العاديين وبين الأشقاء. أوكي. فعملوا إيش؟ بصوا لأول زيارة للمرضى، للأوت بيشن وإن بيشن، مع اللي عندهم تشخيص أولي للعدوى الشديدة ذات معدلات الوفيات المرتفعة، مثل الإنتان والالتهاب الشغف والالتهاب السمعية.
هذا تقولين بالميديكال تيرم يعني حتى ما يقرأ ميديكال تيرم.
endocarditis and meningitis or other central nervous system infections. وبصوا في السجل الوطني السويدي للمرضى والوفيات اللي ماتوا من العدوى، وكانت سبب الوفاة يعني مكتوب عليها إنهم توفوا علشان الأمراض دي، ولا or they got infected with it. وبعد ما تحكموا multiple confounders، العوامل اللي ممكن تتدخل بالتحليل البحث، استعملوا حاجة اسمها hazard ratios of these life-threatening infections. يعني إيه hazard ratio؟ هو مقياس لتأثير التدخل على نتيجة الفائدة بمرور الوقت. نسبة المخاطر يتم الإبلاغ عن نسبة الخطر بالشكل الأكثر شيوعاً في تحليل الوقت إلى الحدث أو تحليل البقاء. مش عارفة ده أنا مش فاهمة عليه أصلاً. But what it means that to
even Dr. Dania من Australia asked to go ahead with English.
with
So
English.
don't disturb yourself. Just go ahead with English. Yeah.
Okay, the hazard ratio is the hazard rate corresponding to the conditions يعني مقدار الخطر يعني الواحد حيعيش قد ايه بال
Life expectancy.
hazard ratio. The chance of an event happening in the treatment arm. The risk of outcome in one group, the risk of outcome in another group, and looking at what's happening at any given time. Does that make sense? Can you understand what a hazard ratio is? Okay, and فبصوا للهازارد ريشيو للمصابين والغير مصابين وقارنوهم علشان يدونا نتيجة. They did something called population matching. They matched two groups of people. They matched general population with people with infections and the siblings of the people who have infections with stress and their siblings who have no symptoms of infections and or stress. Does that make sense? So they made two groups. They matched two groups. The infected with the stress diagnosis with a group of the general population with no relation to them and no diagnosis of stress or diagnosis of physical problems, infections. And the other group was the siblings of those who are infected and those with diagnosis of stress disorders with their siblings who have none of that. Okay?
Yeah.
هم بدأوا they did the follow up المتابعة من تاريخ من تاريخ الفهرس حتى حدوث أي نوع محدد من العدوى التي تهدد الحياة أو الوفاة أو الهجرة أو نهاية المتابعة. مين اللي حصل قبل الانفكشن ولا الستريس ديس اوردر؟ and the stress related disorders استعملوا الاي سي دي as an indicator of the diagnosis the person has in the registry, in the National Patient Register. So you can see in the paper. What is the paper?
أعتقد أكو إنه ما راح الصورة عندك لو شنو؟
I just wanted to go through the paper because I can't see the paper now, and I'm just making things up as I go on. What is it?
Just bring the Explorer pack, متصفح Explorer pack, and it was beside the document. You can try like to stop the sharing and restart again. You can start now again.
I can't see anything. Sorry.
Make sharing now, new sharing, and choose the paper or the Explorer.
Okay.
Should I bring it from my side?
Yes, please, if you can. Yeah.
Yeah.
Oh, yeah. Okay. Well, can you go to the abstract?
So it is like this because I have another view. So this is abstract.
Okay. Okay. They
What we need now?
go down. I have to bring it up so I can control it.
I think try from your side. Could be much.
I'm really sorry, guys. But
It's okay. Don't stress yourself. Yeah, but it is there like just next to the document, stress related disorder. Like what you open now? You shouldn't change anything, I think.
I didn't change anything. Okay. Share again.
Okay, it's okay.
Oh, I can't see anything. Okay, let's share this now. Oh. Is it this one?
It is not between this one and the Word document. Yeah, above, just above. Go up, little bit more. No, yeah, this one. This is the third one from right, from left.
Oh gosh, brilliant! Huh?
Just relax, also. It is the third one from left up.
1, 2, 3.
You choose now the fourth. Just go to take the third.
And this one.
Yeah, you have to go in the top. Like the first one applying for property, I don't know. The second one document 66. Third one is the chosen one. No, up, just in the top.
Here.
Yeah, this one.
All right. Okay.
What you open now?
I opened the Dropbox now. Okay. Okay, I can just pretend I know what it is and go for it.
So go back. Yeah, exactly. Yeah.
Okay. I'll just use the screen, my screen, okay?
Okay.
Okay, let's start again. It's stress-related disorders and subsequent risk of life-threatening infections. This is obviously, it's a cohort study based on population and sibling controlled matching. زي ما قلنا هم كانوا عاوزين يعرفوا الرباط ما بين الاسترس disorders الأمراض infectious diseases infectious diseases, but in particularly sepsis, endocarditis, and meningitis or other central nerve system infections. يعني severe infections تؤدي إلى الوفاة mortality rates with higher mortality rates. هم يعني they used looked at 144,919 individuals with stress-related disorders. لما نقول stress-related disorders, the subgroup, although they looked at stress disorders in general, the subgroup was they specifically looked at was post-traumatic stress disorder, acute stress reaction, adjustment disorder, and other stress reactions. الفترة طبعا اللي هم they identified ما بين الفترة الزمنية 1987 لغاية 2013. يعني دي يعني على فترة زمنية طويلة طبعا. وكمان بصوا ل 184,612 full siblings of individuals with a diagnosed stress-related disorder. وعملوها matching مع طابقوها مع individuals without diagnosis from 1,449,190 of the population in that registry. Main outcome measures. The main outcome measures, I don't know why they call it main outcome measures, even though in here they're just telling us what they did. So they are not telling us what they used specifically. All what they say is that they chose from a population who visited the inpatient or the outpatient with a primary diagnosis of severe infections with high mortality rates. From يعني أخذوها منين؟ عرفوا المعلومات دي منين؟ The Swedish National Patient Register. And that's from these infections or infections of any origin from the cause of death register. وما يعني I don't know why they are telling us it's a main outcome measure, because all what they're telling us here is just we looked at the Swedish National Patient Register and we found out about the cause of death through the cause of death register. بعد ما طبعا عملوا controlling for multiple confounders هنعرفها بعدين، واستعملوا estimate hazard ratio. زي ما قلنا hazard ratio is the chance of an event happening in the treatment arm. Yeah. So, and then they tell us in the abstract the results. هم لقوا ايه يعني؟ هم من المجموع اللي اعطونا اياه 1444 919,000. The average age was 37 years old for men. يعني من مجموع 144,919 39% منهم كانوا رجالة. mean follow up of 8 years يعني المتابعة نسبة the mean follow up was 8 years والmean age was 37 years for men. Okay. And the incidence of life-threatening infections per 1,000 people, let's say per 1,000 person years يعني مجموع العمر was 2.9. Individuals with stress-related disorder 1.7. 1.7 in siblings without a diagnosis and 1.3 in matched individuals. أنا يعني أوكي أنا مش شايفة فرق كبير ما بين siblings وبين matched individuals, which means that tells us that it was significant and as significant for the matched general public as well. Yeah. For the siblings and for the general public as well. Compared with full siblings without a diagnosis of stress-related disorder, individuals with diagnosis were at increased risk of life-threatening infections. يعني generally اللي عندهم stress disorder were at higher risk for of life-threatening infections, particularly when they looked at the sub themes within the stress disorders such as PTSD. The stress-related disorder, the significance was 1.47. للجروب الأولاني أنا يعني أعتقد لما when they put the brackets, the confidence intervals 1.37 to 1.58, I'm assuming the first was for the siblings and the other one was the match population. And for PTSD يعني ما فيش فرق كبير ما بين في الستريس ديسوردر. for PTSD ما فيش في فرق كبير على فكرة في ال PTSD. For the siblings, if we say 1.46 to 2.52 general population. I mean, sorry, not for the siblings with the diagnosis compared to those without diagnosis.
Yeah.
So here the 1.37 for the stress disorder to the 1.58, that is the siblings with conditions and the siblings without conditions. But it's more significant for PTSD. corresponding estimates in the population based analysis يعني هذا السيبلينجز اللي عندهم المرض والانفكشنز والكونديشن mental disorders، ودلوقتي البوبوليشن اللي عنده المرض the both mental disorders and the physical problems compared to those who do not. Now 1.51 to 1.65, I don't think that is a huge difference, even though the saying is significant for any stress-related disorder. But for PTSD, again, we see the figure going up, doubling almost. Stress-related disorders, generally they found, were associated with all studied life-threatening infections, with the highest relative risk observed for meningitis. Again, and for those, for the siblings, for those who have, there's a big difference. Meningitis and the meningitis with the stress disorder, with those who didn't have it, there's it jumps, it doubles here. Endocarditis also almost doubling. Does that make sense?
Yeah. But I think we don't need to go in such details. Like,
no, why am I going through it in such details? Because I want to jump to the methodology for us to look at the things they claiming here is it's huge. They're telling us there is a clear connection between the infections and the life-threatening infections, the coexistence of with the diagnosis of stress disorder.
Mm-hmm.
For the younger age, obviously, the hazard ratio for substance misuse and younger age at diagnosis of stress-related disorder and the presence of psychiatric comorbidity, especially substance use disorders, were associated with higher hazard ratio, whereas use of selective serotonin reuptake inhibitors, the SSRIs, in the first year after diagnosis of a stress-related disorder was associated with attenuated hazard ratio. Now we know that mental health in general does increase mortality rate for everybody. Studies showed us that it cuts the life expectancy for men, for example, by 10 years.
Mm-hmm.
And life expectancy for women about 7 years.
Mm-hmm.
Here they're using specific in the introduction and later in the discussion, huh?
Did we finish the presenting of the paper and in the discussion we are now?
No. I'm just making a statement.
Okay.
What is important here? Yes, they are making a connection between the link between infectious diseases and diagnosis of stress disorders. However, let us look at the study design, but just briefly, okay? How long do we have, Abdullah?
It's okay, like if you finish in 5-10 minutes would be good. But if you go to the like method, you can find it in the graphs will be, I think, easier. Just go down, there's the graphs. And they had nice.
Oh no, because what is important here, when we, it's not important, the result itself, it's not important.
Yeah.
The methodology, what they did is important for us to think about the validity of the conclusions they are making. Does that make sense?
Yeah.
So one thing that I noticed, even though they looked at they're claiming that these are Swedish population, they didn't give us ethnicity. Did they look control for ethnicity, for example? They looked, however, the parents of the people they found in the register, okay, and to make sure that they were Swedish. However, they didn't tell us.
Yeah, born in Sweden.
Born in Sweden, yes, but that doesn't mean that I don't know that if it means anything really. I feel that is a generalization. Another thing that I noticed as well is the fact that they used الدخل الأسري, when they match for sex, gender, and income, they're saying that they looked at 3 categories in that: 20% of the top, middle, and 20% of the lower income. They didn't tell us their definition of what constitutes the 20% of the top income and the lower income. Why am I saying that? Perhaps that's because I know Sweden is their living standards is higher, for example, than in Britain, and the income. So what is considered as a higher income in Sweden might be different than what is considered higher income in Iraq, or also in London, for example. And what that then have an implication, what implication that will have on the findings. I just want us to think about that. Yeah. Can we then generalize this paper to a population in Iraq or a population in the UK? They found that there was an age-dependent risk pattern which suggested a linear decline in hazard ratios with increased age at diagnosis. So the older you are, when you were diagnosed with stress and the consequent infections, the hazard ratio decreases. That's an interesting thing. I thought.
And this is telling that there's less effect from the normal comorbidities, as usually with the age, the risk for heart disease or such things increase. Yeah.
Yeah, but here the hazard ratio declines actually for all the age. But in the methodology, they control for that anyway. They didn't. There was specific diseases that they controlled for.
Mm.
Okay, so they I can't remember what is specific inherited diseases from the families. They diseases that existed before the diagnosis of the mental disorder. And the also they controlled for I can't remember what it was, but
like they shouldn't be like the mental health disorders disorder not before age of 5.
Oh yes, before the age of 5, family history, because obviously the family history will increase the risk of somebody being vulnerable to specific infections.
I think we are already.
Sorry?
I think we are already in the discussion of the paper. We're discussing the paper now. Yeah.
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 Okay. Yeah. Let's.
You're already doing the discussion of the paper.
I'm just أنا عندي انحياز for qualitative studies.
Yeah.
With studies like this, I feel the quantitative studies, I feel we go with a particular hypothesis in our mind and we just try to prove it. Yeah. Which is the normal thing we all should do, but I feel there is always a bias towards finding something, even though this particular group tried their best to control for loads of things, loads of different covariants. I still feel that they didn't tell us anything that we didn't know already. Good and important paper. However, we cannot generalize it based on the fact that we don't know what ethnicity the people were. And also we cannot generalize because Sweden is different than Iraq and is different than London. So we don't know what the income, top income and low income is. Also, they found that those who were diagnosed with the mental illness with and the individuals with the diagnosis tended to have lower family income and were more likely to be divorced or widowed. So this will tell me straight away that divorced or widowed, okay, how that again will impact on the results we are claiming in this paper. Does being divorced or widowed, we don't know other things like other social variables, like if they are in employment, we don't know if they are in employment, because that obviously will give us an indication of them being socially active. But if you just tell me they are divorced or widowed and that's all we know, then I might assume that perhaps maybe they are isolated. And maybe this impacts on, with a low income, impacts on the quality of their life. Food that they eat, loneliness, it's another something that we cannot control for. Anyway, let's open this for discussion. And
can I say okay, can I say my comment or okay, finish. Sorry, first finish, go ahead.
So even though they did their best to control for covariance, they're raising more questions at the end. So they're making big claims of connections and significant. Yes, it's significant, not a lot, but when it comes with PTSD, we know there is a huge, it doubles.
Yeah. Uh, can I close the screen sharing to
Yeah.
start the discussion? Just to not run with that time.
Yeah.
So I would like to invite everyone to open camera if that possible. To be much better for interactive discussion.
Okay. I just wanted to apologize for the hasty
No,
start because I
no.
just got
It's
nervous.
completely okay. It's completely okay. Well, my first comment would apologize if I will start before others, but if others want to say something, or should I say my comment? اللي يحب يتكلم قبل يعني ما يحتاج يرفع ايده. ابو جاسم تفضل. دكتور محمد.
السلام عليكم.
عليكم السلام.
Thank you, Dr. Warsan, for your kind presentation. I just have a comment. I just want to clarify this point, if you don't mind. So in the paper, they just write down, surprisingly, post-stress related disorder, the mortality rate, it is kind of not related to PTSD. It's kind of related to heart disease, infection, or carditis, or something like this. But how we can judge, is this the main cause? Because if the patient had a citrus disorder, he might neglect himself. If he catch infection, he will ignore himself. Then he will lead to die, right? So
Yeah,
probably those kind of diseases might be a cause or due to neglection of someone self, because he had a depression or he had a citrus or he can't control himself, right? So at the end, it is related to the citrus, right?
Yeah, absolutely. Yeah. No, you're right.
I will jump. Just I want to like spare the time. 2 points I want to say. First, if we look to the design of this paper, what they did, it is really important that this paper not for its results. This paper looked to me more, this is my impression, that it is for warning alert. How? First, it is the cheapest type of research. They look for like it's prospective. They look for already ready data, analyze it, and give you a result to say this topic is important. Because to plan a perspective, to plan a huge study with a lot of details, you need a big fund, and it's not easy to convince the sponsors for it. But if you had such a paper, and then you have a hypothesis to prove this in more details, it will be much easier, I think. So if we look from this angle about this paper, it will be accepted. 1, 2, there is, as Dr. Muhammad said, I think there is 2 hypotheses about the reason. First, stress-related disorder will clearly increase the the serum cortisol in blood. Unknown serum cortisol or blood cortisol will inhibit your immune system, so your risk to have like a life-threatening infection will be higher. This can be one, with or without, or another reason, what you already mentioned, that this patient may be not direct connection, but maybe they will be more like because depression or anxiety or distress impact, that they will not care about themselves, which may lead for like serious complications of any small infection. Can be one of those 2 or both of them. Anyway, this need to be tested. Many things the paper ignored, for example, medications. Yeah, what is the chronic medication of this patient? Although they are young age group, but for example, many young patients, they receive like cortisone, like for any autoimmune diseases, which inhibit the immune system, and this is itself a big risk for severe infections. Yeah, for other, as you mentioned, like ethnicities, but I think they want just a warning study to be used as part of gathering other informations to start more details studies. Then in the end, they may make a systemic review or meta-analysis to have like more scientific and focused results. Yeah, this is my impression. Maybe others.
Yeah, you're right, Dr. Abdullah. However, they do talk about the SSRI's intake, and they link that also to an indication of an infectious the development of infectious diseases. Well, my question is, wouldn't the SSRI then control the serum cortisol?
No, SSI, it will just decrease a little bit the effect, the stress itself, which is like serotonin serum inhibitor that
SSRI, yeah.
yeah, which use a lot in by stress disorders. So it will decrease the stress itself. Then the impact of the stress itself will be decreased. Like that, the patient will have less like stress. Then maybe if the problem, for example, because of that they be careless about themselves, then this will be decreased. If it about cortisol will be as a result of stress or any anxiety or depression, as it is active stress hormone. So when you decrease the stress, usually this will be result in decreasing the cortisol. So indirect, but they do talk about other immunosuppressants, like I mean, in the history, if it was included or excluded, all this because a big number of patients without mentioning, and it will be really amazing study if we had the cortisol level in that study. But this need a prospective study, not a prospective.
Okay, just a quick thing, because in the study they say the risk ratio, hazard ratio, was higher amongst those who used alcohol and those who were on SSRIs. So,
but in the same time, they said those with SSR, the results more confusing, as I understood. Yeah, or is it decreased? Anyway, it is like itself. It need a more focused study to see if the SSRI itself has any impact. This is not focused study to judge such hypothesis.
okay. So the question is, can we actually? We know it impacts on the immune system, stress. But is it stress itself, as Dr. Mohammed said, or is it the quality of life of the person, self-neglect?
Can be both. Can be both. And such hypotheses need to be tested. Like, you know, like opinion is the lowest in medicine as its value. Like, anyway, it can be like this study will be like a pilot for more
Studies,
like,
absolutely, yeah.
yeah.
How can we control then? Because I know the quantitative researchers, they claim that they can control for covariance, but how can you control for these things? I know they did as much as they can to match and also control other variables that could interfere with the results.
So I think to have more like to focus on details, but then you will need many studies. Like in one study to have like pure group, like as the control. Dr. Mu'min asked why siblings useful like to exclude any inherited problem.
Okay, the matching for siblings.
Yeah.
Yes.
If because maybe the problem come of like inherited problems. When you have the siblings, then you decrease the like any impact from inherited disorders. So then I think because we have now two hypotheses about the cortisol as a reason to inhibit the immune system, and also the secondary impact or consequence of the stress, like neglecting, as Dr. Mohammed said. So we have to have more focused study to test this hypothesis and see which one like more significant.
Okay.
Yeah.
I have, sorry for interruption. Let's assume the patient had an organic disease, like for example, meningitis, right?
Mhm.
And during the process of disease, he might end up with stress, right? Before he gets cured, right? But after curation, after he gets healed and fully recovered, why the patient will end up had stress? He's supposed to be happy.
Why?
He gets a cure, right? During the process of the disease, okay, he might run through a lot of like feverish, whatever the sign and symptom he might sustain, right? But after recovered,
Yeah.
we have to study why he end up having the stress.
So let's move now.
He's supposed to be happy. He's supposed to return back normal.
Let's move now for the general part about discussion the topic in general, not about the problem. With permission from Warsan to answer this question, or Warsan, you have an answer, or would like to answer?
Okay, I missed that question altogether. Sorry.
Like, Muhammad asked why if the patient cured, then they will have stress, which is type of post-traumatic stress syndrome, but after the disease infection, which we see it now a lot of by COVID patients.
He's supposed to be happy.
Yeah, but like I will answer part. Maybe Warsan will add something after permission. When you have long term of inflammation in your body, what do you expect as impact on your like neurological neurology, your immune balance, all of it will be disturbed. That's why we see a lot of patients post-COVID, they recovered, but they have memory problem, like attention, many other like psychotic and psychological problems, which can be a reason. We had many papers we shared already because of the long-term inflammation. Even we have many patients with peripheral neuropathy. Sorry. After COVID, we give them B12 like a neuropathy infection 3, 5 or to 5 days. They get well. We have many patients with thyroiditis post-infection, post-COVID. For example, this one of the studies showed that. Yeah. Well, Warsan, if you would like to add something.
Well, generally, I worked in. I think Annie will be a better person to answer this question because she's a health psychologist. I worked with the pain clinic, and we know stress leads to infections. Infections lead to stress. There is this. It's a cycle, really. So what we used to do is to help decrease the stress, so people can have a better quality of life and can live better, with not take the condition away, but in the context of pain I'm talking about, not infections only. So did that used to have an impact when after we treat them, they should be so happy and in a better place. So what that is not impacting on, it does. It does impact on the way they engage with their conditions, and it does impact also on the prognosis, the length of the dependent on the condition, the quality and impacts on the quality of life. However, I know this study was between 1987 to 2013, was it?
Yeah.
I mean, that is a long time to well, we don't have the information that we don't have is whether or not, we know they are on SSRIs, but we don't know if they got psychological treatments. That information is not available. With PTSD, I don't know if PTSD is even treated in the with the SSRIs. I'm expecting that to be a treatment for stress disorder rather than PTSD. I don't know if that SSRIs. Do you know if is there a psychiatrist here, or do you know if SSRIs are used to treat PTSD?
I think Dr. Zainab, Annie, Dr. Wafa.
I think
They can be used for people with anxiety and depression. It depends on the patient. But
Yeah.
also, I think also there's probably a selective bias to who's receiving SSRIs. They may by definition be the most severe symptomatically. Maybe that's probably why they have a higher infection. So it's not the SSRI causing it. Maybe it's a proxy of more severe illness as well.
Yeah. And I'm not sure if SSRIs anyway are used for severe anxiety disorders.
They're used in conjunction. People normally have a multitude of symptoms. The only other thing is, so in the more recent DSM diagnostic manuals, the reckless behaviors are a symptom of PTSD as well. And the impulsivity, and I think we've already spoken about lifestyle, but also sleep patterns, circadian rhythms can be disrupted. So there are a lot of intermediate sort of variables intervening between the stress and the infection over time, including the biological factors. Cortisol's been mentioned, hormonal changes, the fight or flight, being constantly in fight or flight alters your neuroendocrine system. There's also the sleep patterns get disrupted because of flashbacks, depending on the symptoms of PTSD. So very often people don't get deep stage sleep. That's disrupted. They have insomnia. They have very, fragmented sleep, which can also cause circadian rhythm disruption and more biological changes. There's just so many factors that could be unfolding with these patients. Really difficult, quantitatively or qualitatively, actually, to have any causality. And also the risk-taking, impulsivity, substance misuse, other destructive behaviors, which are stress-inducing as well. They propagate the risk, gambling, other sort of reckless, destructive behaviors as well. So I think if those are not measured, it's really difficult to know what's causing what, other than there are correlations over time.
Absolutely.
Although we have many studies now, for example, COVID-related, we have one study connect the cortisol with severe infection, high cortisol and chance of severe infection with COVID. And cortisol itself, it's the joker here. With fight or flight activation, you activate the cortisol. With any of those, what you said, when you have like less sleep or sleeping problems, you have high cortisol as a defense. All this will be connected. Yeah. So, yeah.
But the question, I think all things that we raised here are quite important, because then what the implication? They do talk about sleep, alcohol misuse, people being with divorce or widowed, so elements of loneliness there. But we can't, I think this paper leave us with more question than answers.
Of course, yeah. But what you just mentioned, all of them are etiology or a reason for stress. Like dosing, the bereavement, all this, a reason for stress. So, but I think what is not accepted, in my opinion, to have the ratio, not like it's like 35 male female ratio. So the female ratio was much higher, and they like talk about this, and many studies showed it is not equal. Like we have to have, like, although to have two separated group, male and female, and study each one alone to see the gender impact, or to have the like equal, almost equal ratio, to have no bias here, or I think any impact from the gender ratios. Dr. Annie, come, please.
Is she hiding Annie somewhere? Did I put you on the spot? Tell us why they are not happy.
I'm waiting to hear from my senior colleague Zainab. I would love to hear more from Zainab. So
You wouldn't, Annie.
I just want everybody to, because I haven't introduced Zainab at all. Zainab and I go back something like 25 years or something, like, just shows our age, right? So, but Zainab is like, she's probably like one of the most senior psychologists, like here, you know, in the UK and probably internationally. She's a consultant forensic psychologist, and, you know, a lecturer at Oxford University, Lancashire University. I just want to introduce her because she's such a valuable resource for our community. So I want to step back today and just hear from Zainab. She's absolutely full of knowledge and skill and competency. So so this is why, I mean, I'm just going to say goodbye, and I'm still here, but I'm just going to mute. So I would, again, Zainab, sorry for putting you on the spot, but I'd absolutely love for you to lead one of these sessions. We would gain so much from you.
Absolutely. But you haven't said why they are not happy yet.
Exactly. I'm why she's getting away with this. Annie, what was your opinion on this?
I'm just unmuting. I don't have any opinion. Like I've got a lot of noise in my background with my kids, so this is why I'm like, you probably will hear it. So this is why I'm kind of in between cooking dinner and listening. So I'm sorry, my brain is not on high alert at the moment, so I'm not going to say anything. But of course, in the presence of Zainab, I don't want to say anything anyway. So please, Zainab, go ahead.
Annie knows a lot. Actually, from a health psychology is really important here, actually, because I think a lot of these things really speak to the health, biology, and lifestyle factors as well. So I think Annie is being very modest. She probably has the most to contribute to this room. But she's disappeared. She's doing the cooking.
It's coming back to you, Annie. Okay.
I think, can I just go back to the infections and impulsivity? So I think some of the things we're learning from COVID, this is not my special area. So some of the things we've learned from the COVID, the sort of short-term studies are lifestyle impulsivity, even ADHD raised the prevalence of infection rates, which it makes sense. Impulsive lifestyle, impulsive decisions, not being able to stick to rules, that kind of impatience at following rules, hygiene. So a lot of these really minor level, low level behaviors could be the intervening variables between stress, infection, more stress. A lot of the behaviors also self-propagate stress. So a lot of patients with PTSD self-medicate, which may not be measured. They measure alcohol, but they don't often ask about, you know, street drugs. People don't often disclose about, you know, street drugs, illegal drugs, other destructive habits, you know, self-harm in itself. So I think a lot of things that I would expect to be quite key to infection rates are not measured in this study. Mm-hmm. And also the diagnostic categories have changed during that sampling period. So even the people diagnosed may be slightly different cohorts over the years, depending on the diagnostic measures.
Yeah.
So more questions than answers, possibly.
Absolutely. It's just we're coming back to what Dr. Mohammed raised, actually. Thinking about this group, some of us being in psychology and Al-Ataba group also being a psychological service, then it's just, I think, appropriate to ask about what is the impact of what we're doing then, if these people having the study looked at, it's a long period between 1987 to 2013, even though they didn't give us a lot of information about what sort of medication they are on, apart from the SSRIs. But I'll be interested to know if this group of people have received a treatment for psychological treatment at any point of their lives, and how the infection, the development of the infection, the length of period between the psychological intervention and the infection itself. So yeah, I'll be.
I think that means, or what you asked is to design a new study. We have three categories or three groups: one healthy control group, one with this stress disorder without proper treatment, psychological or psychiatric treatment, and one with proper psychiatric or psychological treatment, and to compare those well controlled or uncontrolled, and see the difference on that. But yeah.
Yeah. What about the other members of the group?
Other participant.
Are you all there?
السلام عليكم.
عليكم السلام دكتورنا.
شلونك حبيبي؟
حياكم الله. انت مختفي باسم مستعار.
قاعد استعمل الاكونت مال اخت غفران.
حياكم الله، فرصه سعيده شفناك مره ثانيه.
الله يخليك، شلون صحتكم؟
الله يسلمكم.
Alaikum Yasser, good to see you. How are you? Abdullah must have got a shock. Like, why are you on Gufran's text?
She twisted my arm and asked me to get involved and to listen in and provide an opinion.
Please do. It'll be lovely to hear from you from a medical perspective.
Yeah. So for those that don't know me in the group, my name is. Walaikum assalam. شلون صحتك? Nice to see you. My name is Yasser Al-Madani. I'm a consultant respiratory physician. So nowadays I'm very, very busy with COVID, trying to save lives or help people die, as the case may be, unfortunately. But I found this quite an interesting study. It's a very large population actually that they've studied. So over many, many years. So the researchers have actually done a good job in that respect. And the design of the study is such that they've been able to have controlled siblings, so therefore to eliminate kind of hereditary factors, which I think is again a bonus, one of the advantages of the study. Of course, as Dr. Abdullah said, it's a retrospective study, and therefore it's subject to all the biases of any retrospective study. But I think to study. I think someone needs to mute themselves. To study such a large proportion of people and over such a long period of time, it's quite difficult to do prospectively. You'd have to do it retrospectively. So those are my comments, I guess, about the study. Of course, it's a study which proves an association, but not necessarily causality between stress-related disorders and infections. One thing that I did find very interesting is that we've always kind of associated, I guess, stress with quite minor infections like simple viruses and colds and common cold and influenza and what have you. But I've not previously come across a study showing actually there's an association with much more severe infections. And the infections that were studied in this study, in this particular study, were actually quite severe infections: endocarditis, meningitis. These are all very life-threatening infections. So I found that interesting. I agree with Dr. Abdullah's comments about the association with cortisol. So conditions which cause cortisolemia, i.e. raised cortisol levels in the blood, such as Cushing's syndrome, for example, where the adrenal glands secrete excess cortisol more than the body needs. These are associated, and cortisol itself is associated with heightened inflammatory response and a heightened response in inflammatory mediators such as interleukins, interleukin 1, interleukin 6, and these are same interleukins that we are trying to inhibit at the moment when we're trying to fight COVID, actually. So one of the newer drugs on the block is a drug called tocilizumab, which is a monoclonal antibody trying to inhibit IL-6, interleukin-6. But the flip side to that is that actually sepsis or infection in itself will also raise cortisol. So it's a bit of a chicken and egg situation. What causes the other? We've always known that stress and the mind has an impact on the body, and vice versa. And there are so many conditions where we can give examples of that, not necessarily just infections. For example, I'm sure you've all heard of this term, broken heart syndrome. This is actually a real condition. In layman's term, we call it broken heart syndrome. In medical terms, it's called Takotsubo's cardiomyopathy, where someone who goes under extreme stress, such as a recent bereavement, actually has develops a very acute cardiac condition manifesting in chest pain. And actually, they have raised serum markers, for example, troponin, which is an enzyme released from the heart muscle, which goes up in heart attacks. Although this is not exactly a heart attack per se, but it's almost a type of a cardiomyopathy, a problem with the heart muscle. And this is all due to an increase in the in catecholamines, which are hormones such as adrenaline and meta-adrenaline, and these have an adverse impact on the heart. And in the same way, actually, sepsis can do that as well. If someone has very severe sepsis, very severe infection, that can release catecholamines, which can also affect the heart and cause myocardial dysfunction. So it's an interesting study on many levels. It proves the age-long, belief that the mind has a body on the mind has an impact on the body. But what I specifically find interesting is the fact that they've demonstrated an association, not causality, of stress on severe infections.
Yeah, أحسنتم دكتورنا. Really very informative and detailed, and a lot of questions, including Warsan, my question, and Dr. Muhammad questions, and also had a nice connection with the presence, with the pandemic and COVID especially. Yeah. If the other colleagues question or comment, please.
I think I think we are all in a thinking mode now. It left us with a lot of questions.
Yeah, and Dr. Yasser gave us a lot of amazing information that really shocked us and increased our cortisol. So although it's very informative, but maybe it increased our risk for severe or life-threatening infections. Yeah.
The only thing is, coming back to this paper, why it's very, as Dr. Yasser said, it's a large population, participants there. Yes. However, what new information did they give us? We already the shift from the biological model in how the system operates in Britain. We shifted to biopsychosocial, and we know there is a relationship between our brains and bodies, and they're not separated. However, why I have a problem with quantitative large studies like that, because they're giving us an indication of, for example, matching for siblings. I mean, they trying to imply that this is something similar to twin studies, but it's not actually, because if a sibling has a mental health condition and one hasn't got a condition, we know the likelihood the one with mental health conditions to develop certain physical conditions as well. But this, they said we matched siblings, but they didn't actually match. They just match whether one has the conditions and the other one hasn't got the conditions. So it's not really matching. And this is not a longitudinal twin study that told us that these two siblings grew up in the same place and then they developed, they had different trajectory. And therefore, this proves our hypothesis. I don't see it that way, even though it just confirms what we already know. There's a connection between the biology and the psychology and the social as well. But the social aspect is missing from this study. Is just saying.
But maybe one of the main reasons for this study is to answer the question, or what a hypothesis of many, like of the colleagues like Dr. Yasser himself said, that it is thought, or they think or believe that stress-related disorders may lead for mild infections, not life-threatening infections. So they want to test the hypothesis of it will lead even for the life-threatening hypothesis, infections. And they found some connection, which can be tested in more specific, detailed, planned, programmed studies. And this is not like mostly when we want to make like robust opinion, we don't accept one study. The best studies is the meta-analysis or systemic reviews, because they have many studies together and show really robust studies, or like results. Thank you. The study I did. Habib Dr. Ahmed, thanks for your attending, presence, and time. Yeah, Dr. Ahmed said that, as everyone said, that this study leaves us for many questions, and I think this is the main advantage of this study. It will make people questioning. Yeah. So we can't in one study get everything. Yeah. الله يسلمكم دكتور ياسر. إن شاء الله نشوفكم في الجلسات القادمة، ويعني جدا أفدتوا الجلسة. I think time already jumped half an hour more than what we planned. شكرا لكل من حضر هذه الجلسة، شكر وتقدير ومحبة زميلتنا دكتور ورسان اللي أبذلت جهد يعني جميل اليوم حتى تقدم لنا هاي الورقة، وكانت يعني تعبت اليوم هواي ويانا. هاي بعد التكنولوجيا ومشاكلها. الزملاء اللي قدموا وشاركوا، يعني خاصة دكتورة أني، دكتورة زينب، يعني هم كان مداخلاتهم جدا نافعة ومفيدة لنا وجدا يعني قيمة بصراحة. وإن شاء الله نأمل إنه نشوفهم، خاصة دكتورة زينب اللي أعتقد أول مرة تنضم لنا، إنه بالجلسات القادمة هي كل أسبوعين، يعني بين جمعة وجمعة إحنا عندنا هاي السيشن، أسبوع نخلي منتل هيلث وأسبوع نخلي يعني ميديكس. فيا ريت هم تنضموا لنا حتى نستفاد. وهدف هذه الجلسات هم تثقيفية، إنها هم زيادة يعني نوع من تريننج إنه يعني بصراحة لكل الزملاء، خاصة زملائنا اللي بالعراق، من جانب نقوي التفاعل ويا الأوراق البحثية، نصير more familiar with like the scientific paper, break the ice as I call it. ونفس الوقت هي المعلومات تكون يعني خاصة عندنا المنتل هيلث كلش يعني مهمول بالعراق مثل ما تعرفون وبل بأغلب دول العالم يعني. هذا الشيء راح يسوي نوع من ميرجنج يعني ما بين المنتل هيلث والميديكال كير اللي نحتاجه جميعا. كذلك الزملاء اللي بالمنتل هيلث راح يصير عندهم نوع من التقارب بالافكار بالفيزيكال هيلث، وهسه خاصه من مشاركه الدكتور ياسر. فان شاء الله يعني اتمنى التفاعل المستقبلي والحضور الدائم، وجزيل الشكر لكم الزملاء اللي سالوا واللي علقوا واللي كتبوا واللي حضروا. زميلنا دكتور مؤمن، كذلك دكتورة هدى، يعني دكتور أحمد كل الشكر له، دكتور أحمد درويش أيضا شارك بتعليقات جميلة. عندنا دكتورة أو ست وفاء هم شاركت يعني وحضورها كان إن شاء الله قيم، وكذلك شكرها. والست الزميلة الست إسراء هم شكرا لكم على وقتكم وحضوركم، وإن شاء الله نشوفكم بعد أسبوعين، وشكرا لكم مرة ثانية.
بس لحظة يا عبد الله، أنا عاوزة بس أقول لكم المرة الجاية
نعم.
أنتوا قلتوا لي طلاب يعني أنا يعني قلت طلاب يعني معلش هقول لهم أي حاجة بقى وخلاص.
هي واقع الميكس يعني احنا كلنا شو اسمه.
بس يعني الناس أنتوا يعني خلوني الحاجات الصغيرة، أو أنتوا يعني مثلا زينب العطار، دكتور ياسر، وانت يا عبد الله واني، انا بتلخبط اصلا اتكلم قدامكم.
لا انا بالنسبه اعتبر روحي واحد من طلبتش يعني انه يعني هم طالب خاصه بالمنتل هيلث يعني. اني هي السوبرفايزر مالتي بالمنتل هيلث، انا دكتور جاي يتدرب تدريب يعني منتل هيلث، فهم يعني تلميذكم. وهي الدعوه كانت يعني عندنا هم زميلتنا إصداح خرجت من المجموعة قبل شوية هم من طلبة الطب مرحلة رابعة، يعني أكو مدعوين بس بعضهم حضر بعضهم ما حضر. الدعوة كانت لهم جميعا يعني، وهي إن شاء الله الفائدة للكل بالنتيجة يعني. واقعا فائدة جميلة وجهد مشكور من عندكم، وإن شاء الله تشوفكم في جلسات أخرى يعني.
عفوا، يلا
إن شاء الله. شكرا.
وأنا استمتعت بالنقاش، مع إني كنت أفضل إني أسمع أكثر من زملائنا اللي معانا، بس معلش المرة الجاية كل ما نعمل الجلسات هاي كل ما نرتاح مع بعض ونناقش بعض أكثر إن شاء الله.
اكو ديس اوردر اعتقد خاصه بزملائنا بالعراق اللي هو انا راح اصنفه جديد سايلنس ديس اوردر. يعني اكثر شيء بالزوم ميتينجز يعني ماكو مرات.
شكرا دكتور عبد الله، شكرا.
حياك الله دكتور مؤمن، الله يسلمك يعني. نعم.
طيب خلاص.
من اكو المقابل عندنا النولج كلها، يعني انا شنو ممكن احكي؟
هو هنا التفاعل يعني، هي بالنتيجه هاي مو محاضره نسويها انتراكتيف سيشنز خاصه بالديسكشن يعني. وهي من يصير تفاعل اكيد راح يكون مفيد للشخص نفسه اللي يتفاعل يعني. اللي
تفاعلت بالاسئله طبعا
ما قصرت عاشت ايدك، بس البيسيف ليسنر ما مو مثل الاكتيف ليسنر واقعا يعني. فان شاء الله ستيب باي ستيب.
احنا بنتعلم منكم كمان يعني، انتوا يعني احنا يمكن فاكرين انكم بتتعلموا مننا بس احنا كمان بنتعلم منكم.
هو بالنتيجه تفاعليه يعني. دكتور ياسر فادنا بصراحه هواي بتعليقه كان جدا يعني سبيسيفيك فوكس، طانا هواي يعني معلومات وكونكتد يعني. والمقابل هم دكتوره زينب كان نوع من يعني تلاقح افكار جميل جدا يعني. وهذا هو يعني الفائده من السيشن، انه مو كل احنا هنا هم ايش نقول one level just to listen، لا ولا صارت محاضره يعني. احنا هي ميديكال جورنال نستمع ومداخله. وهذا هم يعني زملائنا السينيورز انا ما اريد اخسرهم لانهم يعطون فائده ومساعده يعني. تسالوا وحدك بس ستودنت يصير اللود كله عليك، بينما دكتورة زينب شالت جزء، دكتور ياسر شال جزء، فهذا كله يعني هم تخفيف وهم فائدة أكيد.
وكل المدخلات مهمة
أكيد.
لأنه الأستاذ أغلب الأحيان بيتعلم من التلميذ، لأنه أنتوا عندكم العلم الجديد، إحنا علمنا شوية قديم الظاهر.
هو أنتوا علمكم more rooted، يعني الإكسبيرينس اللي عندكم هي اللي يعني هو أنا أعتقد اليانج أو الجينيورز عندهم الإنرجي والسينيورز عندهم الإكسبيرينس. We need them both.
Absolutely, absolutely. Thank you so much guys. يعني أشكركم من كل قلبي، علمتوني حاجات كتيرة. Thank you for putting up with me.
Thank you. It's a pleasure to meet you. شكرا جزيلا.
دكتورة زينب إن شاء الله نشوفكم بالجلسات القادمة، وأنا إن شاء الله أتواصل وياكم بعد إذنكم.
Really was too kind. I wouldn't. I think that just reflects her kindness. I don't really have the credentials Annie described. She's a lot. She can teach every one of us. I think we should have Annie next time.
Honestly, I know, and I know you from Annie long time. Even I'm in the psychological Telegram group, watching for your amazing comments. So I'm watching indeed, long time, not new. So we want to take any thing you'd like to offer from your knowledge for our colleagues, medical and mental health professions or practitioners. So inshallah, say inshallah.
Inshallah. Inshallah, we'll see you all.
Annie say yeah.
Annie راح تتعشى. She's going to have dinner.
Oh, I'm here. I'm just
here.
You guys. I really love listening to you guys speaking Arabic. Makes a change from me waffling on, and it's so good to see Yasser suddenly as a surprise. It was lovely to see you both. Actually, Zainab and Yasser, didn't expect to see either of you today. So Warsan, just want to say thank you so much for really informing us. It's so, and leading this the paper, just making us think about all these things. Otherwise, exactly what we thought, that it does bring up more questions. The more we think about it together, the more we study it, the more we discuss it, does bring up some really interesting questions and areas for future research, future study. And also, I think what's really important is the applicability aspect. Warsan's in our group, and we're really applying the knowledge. And every time we do one of these research seminars, really important to think, so what can I take from this in my clinical application? So it's really made me think as well. Warsan, thank you so much for taking the session today. Inshallah, Zainab, I'll leave it on that point. Thank you.
Thank you, Alwiya.
Thank you. في أمان الله.
في أمان الله. Thanks for your time. And see you inshallah in 2 Fridays.
inshallah.
inshallah. في أمان الله.
مع السلامة. شكرا.
مع السلامة. مع السلامة. حياكم الله. مع السلامة جميعا.